Tumor-induced osteomalacia, TIO, or oncogenic osteomalacia, is an ultra-rare paraneoplastic syndrome due to the ectopic production of the hormone fibroblast growth factor 23, or FGF23, from tumors in soft tissue or bone. Patients present with nonspecific symptoms like fatigue, bone pain, bone fractures, and muscle weakness. TIO is characterized by persistent hypophosphatemia, a low serum phosphate level, which is often missed during clinical investigation. Approximately 95% of TIO cases are initially misdiagnosed, and 80% of patients have a greater than 2-year delay between initial presentation and treatment. This can result in disability, loss of mobility, and severely decreased quality of life. A 16-member expert panel came together to develop guidance for a global standard of patient care and to raise awareness of TIO in the medical community. They used the Delphi method to reach a consensus on recommendations for TIO diagnosis, referral, and treatment. According to these guidelines, measuring serum phosphate levels is strongly advised in patients presenting with unexplained bone pain, muscle weakness, or bone fractures. A careful medical history of a patient should be taken, including family history if possible, and a physical examination must be conducted to assess physical signs and potentially identify the causative tumor. Although specialized imaging is usually necessary to localize the tumor in most cases, the evaluation of urine and serum phosphate and creatinine, alkaline phosphatase, parathyroid hormone, 1,25-dihydroxyvitamin D, and FGF23 should be prioritized. Patients suspected of having TIO should be referred to a specialist to confirm the diagnosis, which must include functional imaging to identify the causative tumor, followed by high-resolution anatomical imaging for precise localization. A genetic test may be used to rule out hereditary causes of low phosphate. Once the causative tumor has been identified and localized, a complete tumor resection with wide margins should be performed. For tumors that are unresectable or cannot be identified, treatment with phosphate salts and active vitamin D or burosumab can be used to alleviate clinical symptoms. These practical recommendations and expert-led opinions, together with advanced diagnostics and treatment modalities for TIO, can help to raise awareness to shorten the diagnostic odyssey and improve patient outcomes in the future.